channel. I'm Dr. Olusegun. Today, the question I got is, Doc, I was just diagnosed with Graves' disease. What is that? So what is Graves' disease? So you guys know we just finished a series on Hashimoto's thyroiditis, which is an autoimmune thyroid disease that causes your thyroid to be low functioning. Graves' disease is the exact opposite. It is still an autoimmune disease, but this time the antibodies that the immune system is making is actually attacking the thyroid, but it's causing it to make high amount of thyroid hormone. Instead of making it not make enough hormone, it's causing it to make too much hormones. So what is the difference? How does the immune system determine whether it's going to be low or high? Well, you have to understand how the thyroid itself works, right? So you got to go back and watch the previous series, but just to summarize it here, the thyroid works by getting a signal from the brain called TSH. TSH is thyroid stimulating hormone. And it sends a signal to the thyroid by waking it up and saying, hey, thyroid, I need you to make TSH and, you need to make T4 and T3. So once the thyroid starts to make T4 and T3, those hormones go back and the brain senses it and realizes, okay, the thyroid listened, it's making those hormones. Okay, we can shut off the TSH now. So then the TSH level reduces so that the thyroid won't overproduce T4 and T3. Hope that makes sense. Okay, so it's a feedback mechanism, we say. The TSH comes, tells the thyroid to make the hormone. Once the thyroid makes the hormone, that hormone flows through the bloodstream, gets back to the brain goes, okay, yes, there's enough hormone floating in the blood now. All right, I'm going to reduce the amount of TSH that I'm releasing so that the thyroid can slow down. Okay, hope that makes sense. So we got that part figured out. So what is happening in the case of Graves'? The immune system comes along and says, I don't like what's going on here. I don't like the look of this thyroid gland, or there's some toxin sitting inside this thyroid gland that I need to attack. Okay, so the immune system starts to signal for other immune cells to start making an antibody we call the thyroid stimulating immunoglobulin, or TSI. So TSI is the antibody that the immune system makes. But the funny thing is, part of this antibody resembles the TSH. Okay, now remember what TSH does. Now TSI is a mimic of TSH. So when the body starts to see TSH, the thyroid thinks when the body starts to see TSI, it's thinking, oh, that's TSH. So it started to respond by doing what it normally does when it sees TSH. It starts to release an excess amount of thyroid hormones, both T4 and T3. So the level of T4 and T3 in the blood in the patient that has Graves' disease is going to be very high. Okay? And guess what? The level of TSH is going to be very low. Why? Because the brain is not the one signaling for the thyroid to make those antibodies, to make those hormones. It is the antibody called TSI that's faking the thyroid out and causing it to make more hormones. Okay, I hope that makes sense. So now once we have that, the brain is now sensing a lot of thyroid hormone and is going, I gotta reduce even more the level of TSH. So the TSH is so suppressed that when we check it in the blood, we're like, whoa, it's way below even the lowest level that we can detect, right? Because the brain is trying to shut this thing down, but it's not happening. Why? Because the thyroid is responding to something different. So that's why Graves' disease in patients that have it cannot be controlled within them by themselves, because this system has bypassed the normal feedback loop. Okay, so what do? We find a patient by symptoms, or we see the physical manifestation. So one of the physical manifestation is the eye involvement. So it's a very unique eye disease called Graves' ophthalmopathy, right? Meaning that the inflammation of the tissue around the eye is so severe that it pushes the eyes out of its socket. And you can see these patients, they have this unique stare. Like they're just staring. Like even though they're not staring at you, but that eye just sticks out of the socket. You can see it, right? So they have that going on. Most of them have trouble with their vision, maybe double vision or pain or discomfort. And if this goes on way too long, some patients have actually lost their vision because of it, okay? So once you start seeing a patient in your family with that eye bulge or that stare that just looks different, like it is something that you should encourage them to go get checked out, okay? Because they might not be feeling that the thyroid is off, maybe because their symptom is mostly just weight loss and they don't have all of the other discomfort like palpitations and sweating and all those things, right? They might just have this eye bulge and weight loss, or there's the eye bulge and some other symptom. The other physical manifestation we sometimes see with Graves' disease is something called pretibial myxedema. Okay, so fancy word for saying that there is like unique skin changes on your shin, right? In the front of your long bones in your legs, there is this redness and thickening of the skin so bad that it's like something is off. Like you don't know what it is, but it looks just thick and red and inflamed. And it's very unique to this Graves' disease because we hardly see it in any other condition, okay? So those two are very, very unique. And we usually, when patient has the pretibial myxedema, they're usually also the same patients that have the eye involvement, okay? But you can have one or the other or both. It doesn't matter. If you see any of them, just get checked, okay, right away. Okay, so Graves' disease, that's what we see, right? So we want to go in the next video talking about how do we treat it, because now that we know how we diagnose it, right? We check the TSI antibody, we check the TSH level, and we check the T3 and T4, and we're able to figure it out. So that combined with all the symptoms you have tells us you have this disease. So the next step is how do we treat it? So join me on the next video as I go into how we treat it both holistically and conventionally. I'll see you on the next one.